Hi, my name is Judy. I will be given an intradermal injection. And with the intradermal injection, I will be doing my GPSP, my 11 rights. And with my 11 rights would be the right medication, the right patient, the right dose, the right route, the right time, the right reason, the right assessment data, the right documentation for the right response, the right to educate the patient, and the right for them to refuse. And with the intradermal injection, given just below the epidermis in the dermis of the skin. It's usually like in the forearm and in the upper back underneath the scapula. And it's used for allergies or TB testing. Okay, I will make sure I ask the patient for if he has any allergies, and I'll check the allergies with the medications and the MARS and with the patient. And the intradermal injection is usually given like 0.1 mLs, and it has the longest absorption time, and you'd usually avoid like any areas of broken or open skin, highly pigmented areas, lesions, abrasions, scars, or hairy parts of the body. And I'll be doing my 3 medication checks, assessing for the proper and necessary assessment data for the patient. I'll know that the actions, the special nurse considerations, the safe dosage range, the purpose for the administration, adverse effects, the appropriateness for the patient itself. Now, with doing an intradermal injection is usually done in like a 15 to 5 degree angle. Okay, I will do my hand hygiene. Get that done. I will pull the medication from the drawer. Lock the drawer back. I will check the medication with the MAR. Make sure it's the right medication with the MAR. And I will recheck the medication again with the patient's medication and check it with the patient's medication on the MAR with the medication, making sure it's for the right dose, for the right patient, for the right medication. I will check for expiration date. I will check the needle itself for expiration date. It's very important. Now, with the medications, I will be doing my hand hygiene again and putting my gloves on. And I will draw up the medication for the patient. Now, with a vial with a cap on it, you do not have to alcohol the top of it because it is considered not contaminated. So, with this one, it's a multi-dose one. It's been opened, so I will alcohol the top of it. I will get my needle. And with the needle, when you're giving an intradermal injection, you will take the needle and you will put it at a 15 to 5 degree angle, just slightly with the skin. Okay, I will take my non-dominant hand, pull the cap off, holding it with my dominant hand. I will take the medication vial and I will insert it. First, I will pull it back, just holding the end of the plunger, pull it back to 1.1 ml of air so I can insert it into the vial to be able to pull the medication out easier. I'll put it in, Push in the air. Turn the vial up. Stabilize the vial with my hand and the needle. Pulling back with just the tip of the plunger. 1 ml. Making sure I'm getting the right amount. Which is right there. Okay. Take it out. And I will insert the cap back on it. And I will gather my stuff. Pull my gloves off. Dispose of anything I need to dispose of. Gloves, alcohol wipes. And then I will gather up all my stuff, go into the patient's room. When I get into the patient's room, I will do my third check. I will check his armband, check for date, birth date, check for his name, date of birth, and compare it with the MAR, making sure everything matches up, compare the dosage with the patient and the MAR, make sure everything's okay. I will check my medication with another nurse to make sure it's the right dosage for the right patient and for the right medication. I'll do my hand hygiene again. And I will put my gloves on. Now when I am inserting the needle under the skin, I'll insert it just an eighth, just right past the bevel part of the needle. I will put it like an eighth in of the skin. I will take my alcohol pad, clean the surface of the skin, cleaning inward, outward, never touching the area twice. That way it's not getting contaminated. Let it air dry, never wave or anything. And then I will take my needle, pull the cap off, and I will go in at a 5 to 15 degree angle. Just an eighth of an inch in, and inject slowly the medication. And then I will withdraw it at the same angle I put it in. I will give them a cotton ball if they need it. Place the safety guard out so I can dispose of the needle. Never massage or hold pressure on an intradermal injection because it can displace the medication. So I will do my hand hygiene again. I will collect all my belongings, take it with me. I will go do my documentation. I will do my documentation to make sure it's put in for the right time, the right medication, the right dose for the right patient. And I will come back within like maybe 30 minutes to check to make sure that he has no skin irritation, no side effects or adverse reactions to it. And then another nurse will check within 48 to 72 hours to make sure that his TB test is okay. And the only common side effects from the TB test is usually like redness or tenderness of the skin. Thank you.